Well, thank you so much, Claudia, Dr. Thomas, for agreeing to come onto the podcast. I'm so excited to have you share your story.
Oh, thanks for having me. I'm excited to be here.
Yeah, so why don't you tell us a bit about yourself and your family?
Okay. Well, I am currently living in Anchorage, Alaska, but we got here by way of Pittsburgh and Seattle and Chicago. So I'm originally from Northern California, the Bay Area. Um, and then I went to medical school in Chicago at the University of Illinois. And that's where I met my husband, who was also in school for education. So he's a teacher.
Mm,
And
okay,
so makes it easy for him to travel around for work as well.
gotcha.
So then we moved to Seattle for my orthopedic surgery residency at the University of Washington, which was 5 years, and then to Pittsburgh for a year for my sports medicine fellowship, and then up to Alaska since I am in the Air Force. They paid for my medical school, so we'll be here probably for 6 years. We've been here 2.5 so far. Um, and yeah, then we had our first son, Stellan, in June, so he's now 5 months old. And so it's the three of us and our dog and our two cats.
Love it, love it. So, how do you like Alaska?
It's awesome. It's really cool. It's we chose it because we liked Seattle and the Pacific Northwest so much, and
Uh-huh.
so it's a lot like Washington on steroids in
Okay,
terms of just, weather and outdoor activities and Um, so
gotcha.
we're into winter now. There's snow on the ground, and we had snow in early October.
Okay.
But yeah, it's awesome.
Are there really days like where it's dark most of the day? Like,
Yeah, I mean in Anchorage, luckily we're kind of halfway through the latitude of the state.
uh huh.
So our longest days are getting on 14 to 15 hours, and then the shortest days are about 6 hours of daylight. But the sun does
Wow.
come up, and it's yeah. So
Okay.
sunrise today was, I think, 9:30, and sunset will be about 4.
Okay. All right. All right. Well, we didn't come to talk about Alaska. I was just curious.
Yeah.
We're supposed to be talking about your birth. So I wanted to start off with the fact that you are a physician. So, but when you went into your pregnancy, what were kind of like your expectations of pregnancy and birth based on your medical training and experience?
Yeah, and so I mean it had been many years, right? It was my third year rotation pretty much was my
Mm-hmm.
last experience with OB. Um, and so I fully expected to have a hospital birth and have kind of all the things that go along with that in terms of the prenatal care. And that's what I was familiar with. And also being in the military, that's what is provided. So I expected that. And other than that, I honestly, a lot of the details of prenatal care and of birth, um, I had just forgotten from med school.
Uh-huh.
And
Of course.
so,
Yeah.
yeah, so I definitely went into it kind of with enough medical knowledge to be able to scare myself about certain things,
Mm-hmm.
but not enough to be able to talk myself out of those
Gotcha. Gotcha.
anxieties.
Gotcha, gotcha. So, what made you then? Well, we'll get to what the things you did to prepare. Let's start off with what your pregnancy and your prenatal care was like. I know that you're active duty military, so that was different. You were also considered advanced maternal age, so maybe that was colored your care. So, what was your pregnancy and prenatal care like?
Yeah, and we had also just started an infertility workup. So my husband and I had been technically trying without, my birth control for
Mm-hmm.
about a year.
Okay.
And so we had gone to see an infertility specialist off base.
Mm-hmm.
And we had literally just started labs, hadn't started any treatment. And
Right.
then, a couple weeks after that, found out we were pregnant. So we joked that there was something in the air in his office that that helped us. But so we had technically started that treatment or that workup. Um, and then
And that's stressful.
yeah, and it was especially yeah, I mean because the labs that I had had so far had come back normal, and so we had started adventuring kind of deeper down that path.
Mm-hmm.
We
Mm-hmm.
felt lucky that we didn't have to uh, go any further into that
Right.
workup, but
Right. Did you
Um,
feel like, when you're a physician, maybe, and especially an orthopedic surgeon, which is a highly competitive field, attracts the best of the best. Did you feel like any sense of failure or like because you weren't getting pregnant?
that's a good question. I would say not yet,
Okay.
um, because because it had only been a year, which can feel like a long time, but
Mm-hmm.
because we weren't really stressing about the timeline of it yet, um, no, I'd say I didn't feel
Gotcha.
that.
Okay.
Yeah,
Okay. Cool.
yeah,
Cool. I was a nutcase after 6 months of not getting pregnant. Like
yeah,
so,
yeah,
like I was like, I don't want to see a pregnant person, and just I'm embarrassed to say that 6 months I was in that case, but I was. But at
yeah,
any rate, so you had just started the infertility, found out you were pregnant, and then what happened from there?
yeah. So the prenatal care on at base for us is awesome. I loved our clinic.
Mm-hmm.
They have a model with midwives and MDs,
Mm-hmm.
as well as some nurse practitioners, and they definitely encourage you to see everyone, or they
Okay.
don't make a point to schedule every one of your prenatal visits with the same person.
Sure.
I could have chosen to schedule with a particular person each time, but I kind of like the idea of meeting everyone.
Mm-hmm.
So my first visit was with a midwife. Um, then a couple visits were with some of the MDs. Um, and yeah, overall, I'd say the prenatal care was really great. And
Okay.
you can definitely hear things about the military, pluses and minuses of military
Sure.
medicine. But I think overall, I was very almost pleasantly surprised with how
Oh,
great the care was. Yeah,
well, that's good. That's
yeah.
good. Do you feel like you noticed the difference between the midwives and the physicians?
Um, I actually wouldn't say that I did.
Okay.
Yeah, in terms of time spent, questions
Mm-hmm.
answered,
Mm-hmm.
things focused on, they were actually pretty similar.
That's good.
Um,
Yeah.
yeah, and I ended up, because I was advanced maternal age.
Mm-hmm.
Um, I had some of my ultrasounds and things off base.
Okay.
So my 20-week anatomy scan, because I guess they needed the level 3
Mm-hmm.
scan.
More detail.
Yeah,
Yeah.
yeah, I went off base for that. And then when I started, um, I again started ultrasounds. I guess it was every 4 weeks
Uh huh.
after 28 weeks. Did some of those off base as well.
Okay. Okay. So they didn't have. I guess it. I guess having maternal fetal medicine specialist isn't really common in the military. I don't know.
Yeah, and that there probably are some who have
Uh
done
huh.
fellowships and are some of the bigger military centers, but
Right.
yeah, we certainly don't have them. But yeah, so
Gotcha.
for that 20-week, I had the scan and then met with a MFM.
Okay. 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 So then, what did you do to prepare for your birth?
Yeah, so I started listening to your podcast, and I will admit I focused more so on the interviews, kind of with specialists early on,
Uh
because I
huh.
didn't think that the birth stories would necessarily apply to me or that I
Uh huh.
wouldn't find them interesting. But those were really my favorites, actually. So as I got,
I swear everybody says that.
yeah, I mean, because you can find something in common with everyone and you
Right.
learn something from every single story.
Right. Right.
Yeah, so I definitely went back and listened to those sort of in a binge listen style. Um,
Right.
but yeah, so I listened to your podcast, and we also did your prenatal course. Um,
Well, thank you.
yeah,
I hope you found it helpful.
we did, and my husband actually he loved it. He's the kind of guy who you have to drag him into things like prenatal courses or birth
Mm-hmm.
courses,
Mm-hmm.
grumbling, but he found it really interesting, and yeah, definitely found it helpful.
Good. Good.
Um,
Good. Good.
and then I read a couple books. I did get What to Expect When You're Expecting,
Mm-hmm.
which is it's just got a lot of info, and it's great. It can definitely, I think, be a little dated at times,
Mm-hmm.
or a little black and white, but it does have a lot of information. And then I read Expecting Better by Emily Oster, which I know a lot of
Ah.
other ladies have mentioned as well.
Yeah.
And I'm actually
Yeah.
reading Crib Sheet right now, which is
Uh-huh.
the book about yeah, I guess infancy and toddlerhood.
Right. Right. Right.
And then I had a book called Pregnancy, Childbirth, and the Newborn,
Okay.
The Complete Guide, which it was good. It was kind of like what to expect when you're expecting, but a little more about, they spent more time on kind of the labor and childbirth process and some of the techniques for pain control and
Gotcha.
things like that. It was a
Gotcha.
little more focused, I think, on um, either home births or like midwife center births.
Okay.
Um,
Okay.
so some of it didn't apply so much to my situation, but it was still good
Right.
techniques. Yeah.
Okay. Okay. How did you come to Emily Oster's book? I've had a lot of. Sometimes I hear physicians in particular like push back against her
Oh, really?
of because
That's
she
interesting.
well she says she says some things in there like, oh, it's okay to have a few drinks, or that kind of thing.
Yeah,
So
it's okay to eat deli meat. Yeah.
yeah,
Yeah.
yeah. Which I've read the book. I think it's great. I think it's very balanced and everything. So, yeah. It sounds like you didn't know that there was some sort of controversy.
Yeah,
But
I
yeah,
could
some
actually see.
OBGYNs in our field.
Oh,
Mm-hmm,
yeah. I could see
mm-hmm.
physicians so liking it just because it is very data driven and
Yeah.
lets you make your own decisions,
Mm-hmm.
whereas the what to expect is a lot more, do this, don't do this,
Right. Right.
never do that. So
Right. 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 Yeah. Maybe it's just OBGYNs who have the problem with the
it might
book and
be.
not
Yeah.
necessarily like yeah.
And then I could see in
uh,
the same vein, like sleep, trained specialists or lactation
uh-huh.
consultants having issues
Mm-hmm.
with crib sheet, which is,
Uh-huh.
more about
Yeah.
the
Yeah.
infant.
Yeah. I haven't read that one, so okay. So what are some things that you wanted for your birth?
So at first I thought I am going to be the epidural lady. I'm the second I hit the
Okay.
door,
Right.
I want an epidural.
Right.
I know myself, I know some of the risks, and I'm definitely going to do an epidural. And then the more I listened to other ladies' birth stories and read a little
Mm-hmm.
more, um, I thought, okay, maybe I could try at least to start
Okay.
labor without it.
Right.
But then, especially as it became clear that I was going to be induced, then I kind of went
Mm-hmm.
back to, I do want an epidural. So that was one of
Okay.
the, yeah, one of the things I knew I wanted to do.
Okay.
Um, Other than that, a lot of the things you mentioned in your birth preparation course that I think are gold standard, but I just wanted to be sure that the
Mm-hmm.
military hospital was going to do them. So
Mm-hmm.
delayed cord clamping,
Yep.
immediate
Mm-hmm.
skin to skin.
Yep.
Um, yeah, those were kind of the main ones. And then I really wanted to try to have a vaginal birth.
Mm-hmm.
Um, and yeah, as we talk more, I guess, about the actual birth
Yeah.
process, there was
Mm-hmm.
definitely a time where that might not be possible. So I
Right.
appreciated the
Right.
team allowing me to continue with
Yeah.
that
Yeah.
desire. But
Okay.
yeah, so overall, I'd say I did make a list, or birth wishes list. I
Uh-huh.
fought back against it at first of not wanting to do it, but then one of the MDs actually at one of my prenatal visits asked me if I had made a birth wishes list.
Oh.
Yeah, I was actually one of the male MDs, and I was like, wow,
Oh.
okay, way to,
Okay.
yeah, burst stereotypes. I liked it. So I went home
Yes.
and made one.
Okay. Well, cool. Cool. Yeah. I mean, we really should, because it really should be a conversation. A lot of it, I think, is just reassuring people that we're going to do the things that we should be doing. Unfortunately, in some places, it's not the case. But it sounds like you gave birth in a place with a group and in the hospital. That was great. So what was your labor and birth like?
Yeah. So as we came towards the end of my pregnancy, my blood pressure had always been something they were keeping an eye on.
Mm-hmm.
Before pregnancy, I was someone who kind of lived in the 140s over 90s, but
Okay.
was never medicated. And so I was sort of labeled as gestational hypertension because those
Mm-hmm.
blood pressures sort of stuck through the beginning of my pregnancy. They actually
Gotcha.
got a little better just by being pregnant.
Yeah,
Um,
that happens. Yeah.
yeah, for sure. I got, relatively hypotensive. But but as we got into later weeks, it started to creep back up, and so I
Mm-hmm.
was doing weekly, um, is it BPPs or the
Uh-huh.
yeah, and yeah, and so then we had started to talk about induction pretty much as soon as I had the diagnosis of gestational hypertension and with my age
Okay.
as well. And so
Right.
they talked to me about um, sort of the timeline of when to do it,
Mm-hmm.
the risks of potentially waiting past 40 weeks.
Mm-hmm.
And I'm definitely a pretty risk averse person.
Okay.
And I had, unfortunately, a few um, pretty close family friends who had late term stillbirths.
Oh my
Um,
God.
yeah, yeah, it's unfortunate.
Okay.
And,
Yeah.
but that definitely, I think, clouded, or not clouded, but impacted
Sure.
um, my decisions about induction.
Right.
And so I was totally on board for being induced at 39 weeks.
Gotcha.
Um, so yeah, so I came into the hospital 39 plus one,
Mm-hmm.
um, and they checked me in, and I essentially was starting from complete ground zero,
Okay.
not at all ripe, cervix not at all
Yep.
favorable.
Yep.
So they checked me and decided to start with a dose of the oral um, misoprostol.
Attack. Yeah.
Yeah.
Mm-hmm. Yeah.
Um, so they gave me one dose of that. Didn't even try the Foley catheter right away just because it was so
If you were
unripe.
closed, they probably couldn't have yet
Yeah,
put it in.
exactly.
Mm-hmm.
Um,
Mm-hmm.
so let that simmer for about 6 hours. And then when they checked me again, um, I'd started to ripen a little enough that they thought they could put the catheter in, the Foley
Okay.
catheter. So yeah, about 6 hours in of that first night, I got a second dose of oral misoprostol, and then they
Mm-hmm.
put the Foley catheter in.
Okay.
Um,
Was that painful?
it was pretty
Yeah.
painful.
Yeah.
And so they did that at about midnight. And so consequently, that first night was pretty horrendous in terms of
Okay.
discomfort. And it was just, I mean, it was pain, but it was also nausea, and
Mm-hmm.
just GI upset. I felt like I was running to the
Mm-hmm.
bathroom, you know, every 15 minutes. Um,
Gotcha.
and because of that discomfort, my blood pressure shot way up, to 200 over
Mm.
110.
Oh. Oh.
Yeah. So there was an hour or two there where they were treating me for, concerning for preeclampsia.
Right.
So I
Right.
got a couple doses of, I think it was nifedipine,
Okay.
but something for my blood pressure, and that helped a little bit. What really helped was actually getting a dose of fentanyl
Okay.
and controlling my pain, and that then my blood pressure was totally normal. Um,
Okay.
that was I didn't love that, the fentanyl. it it just, yeah, I mean, it made me feel totally high. Allowed me to get some sleep, um, especially because we weren't going to be able to do the epidural until the anesthesiologist got in that morning. They
Right.
could have called him in, but I was okay with
Sure.
waiting.
Sure.
But
Sure.
yeah, so consequently, that the first night had its rough spots in terms of the blood
Yeah.
pressure and the discomfort, and then
Right.
um,
Right. Right.
the opiates. Um, but yeah, but then I guess first morning was able to get an epidural, um, and it was great. I felt like you know, I felt like a good epidural. I know there can be good epidurals and bad epidurals. I was
Right.
able to um, move around in bed. Um, I couldn't get up out of bed, um, but I could at least power myself around around the
Got.
bed, turn over, and
Gotcha.
but my pain control was still great.
Gotcha.
So
And did you
then,
still have the catheter in at that point? The
oh,
balloon
that's
in?
yeah. So at that point, I did. I want to say it fell out slash they pulled it out
Uh,
at the check where I got to about 3 to 4 centimeters.
okay. Okay.
So I think it was probably in about a total of 12 hours would be my
Okay.
guess. Yeah.
Okay. So it wasn't like they said you have to be a certain number of centimeters or anything before you got the epidural. It was just like when you wanted it, you got it,
Correct. Yeah.
as it should be.
Yeah.
Okay. Yeah.
Um, and so then consequently the next, um, I guess if that was Wednesday morning, so the next 36 hours really till Thursday night, I was actually pretty comfortable. I was just sort of coasting,
Right.
um, very slowly dilating. Um,
Okay. So yeah, let's talk through that
yeah,
because
so
I'm doing the math in my head now. I was like, wait a minute, you were already 3 to 4 centimeters dilated, and then how long? What happened in that
yeah, so then that was
period?
so I think it was about 3 to 4, Wednesday morning.
Uh huh.
And then uh by the time they checked me again Wednesday afternoon, um, so I'd had the epidural, for 12 hours.
Mm-hmm.
I was still at like 4.
Okay.
Um, and so
And they were
the
probably doing pitocin, I'm guessing at that.
oh that, yes,
Yeah,
yeah, they were, yeah,
yeah,
we had started
yeah,
pitocin
yeah,
pretty much when we started the epidural.
yeah. Okay.
Yeah. Um, and so because I hadn't really dilated much more, they
Mm-hmm.
decided, I should say we decided to break my water.
Okay.
So that would have been, yeah, like Wednesday afternoon.
Mm-hmm.
Um, and that went fine. Because of that epidural, it was not
Right.
uncomfortable. Stellan did, when he came out, he definitely had a little nick on his scalp.
Oh, from where
Looked like
they.
the little, yeah, little crochet
Uh huh.
hook, which I mean was
Uh
fine. Um, he healed fine, but um, so yeah, so that happened Wednesday afternoon, and then just kept trucking through Wednesday night. I don't really think they checked me that much more um, until the next morning.
huh. Okay.
Yeah, because I wasn't feeling any urge to push at that point,
Sure.
and
Sure.
so I assumed there wasn't really much to check for
Mm-hmm.
overnight. So I just essentially could rest um,
Okay.
and yeah, and then at that
Were
point
you able to, were you able to get some rest?
I was for sure.
Okay.
Yeah.
Okay.
And then my husband was there and my mom was also there. And so they were kind of swapping, so that
Gotcha.
they were allowed to, or they had the ability to also go home and rest, which
Gotcha.
was nice.
Gotcha. And were you being cared for by a physician or midwives in those?
Both essentially. Yeah.
Okay.
Whoever was um, on call for that time. So
Oh, so
because of
it
how
was
long I
really
was
just
there,
who
yeah, it was
whoever
really
was
just a
there.
team, yeah, team
Okay.
effort.
Okay. Okay.
And um, yeah, so I ended
And how'd
up
you like
seeing
and
mostly everyone. How did I like what?
gotcha. I was gonna say, how'd you like your nurses?
Oh my gosh, my nurses were amazing.
Okay.
Yeah, there was one who like she made it her goal to have me move as much as I could.
Right.
And so we were doing all sorts of exercises like on my knees with sheets, trying to shake the
Mm-hmm.
baby, not shake the baby, but
Mm-hmm. But yeah,
shake
yeah,
the
get
belly
them
to get
get
the
them in
baby moving.
position. Yeah.
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 Um,
Yeah.
so yeah, they were totally awesome.
Nice.
Um,
Good. Good. Good.
yeah.
Good. So then you
So
got to,
yeah,
was it went Thursday morning by
yeah. So I got to Thursday morning,
then? Mm-hmm.
and by then, I like really had not dilated anymore. Well, we had a couple people checking, so there was that measurement standard of error,
Right.
but I was pretty solidly like 5 or 6, and not more than
Okay.
that.
Okay.
Um, and so then they decided to do a
Where was your headspace? Like, where were you mentally then?
yeah. I was still fine because I was so comfortable.
Okay.
Um, I did know, I guess at that point that we were going to start backing up against um, the amount of time my water had been broken,
Mm-hmm.
but the team wasn't really stressing about that yet, and so I
Yeah.
wasn't stressing about it.
Okay.
I was definitely a little frustrated that my body wasn't responding to the pitocin and everything else
Mm-hmm.
that we were trying.
Mm-hmm. Mm-hmm.
Um, and so at that point, we did a pitocin holiday.
Okay. Yep. We do
Um,
that sometimes. A little break. Mm-hmm.
yeah, so I think it was off for um, what would make sense, maybe 2 to 4 hours or
Couple
so.
hours. Yeah.
Yeah.
Mm-hmm.
Um, so Thursday morning, I had that break, and then they restarted it, back at the low dose kind of Thursday midday.
Okay.
Um, and so, but pretty quickly got back up to the max dose,
Okay.
just because it was, I was tolerating it. And this entire time, Stellan was tolerating everything fine. Like he
Okay.
never
He's like,
had
I'm good.
concerning, yeah, nothing
Right.
concerning. Um, so that was also reassuring for me this entire time was that
Right. Right.
his patterns always look great. Um, so finally, Thursday evening, by that point, my water had been broken more than 24 hours.
Mm-hmm.
And so they started to talk to me about, risks of that.
Mm-hmm.
Um, and if I'm remembering what they told me correctly, um, the data would start to talk about risks at 24 hours, but getting towards, 28, 30, it was okay to them.
Mm-hmm.
Um, but again,
Yep.
with, every hour is a little more risk, in terms of infection. And um, so, but I had started to kind of start to move in terms of my dilation.
Okay.
So I was starting to get, consistently 7, 8 centimeter checks.
Okay. Okay.
Um, and yeah, so then Thursday evening, then we had that talk of, if you don't dilate more, and we're
Mm-hmm.
getting close to 28 hours water broken,
Mm-hmm.
we'll have to start thinking about doing a C-section.
Okay.
And so the first time we talked about that, I was pretty upset.
Okay.
Um, and I lost it. And I was crying, and
Okay.
um,
Okay.
just because it wasn't so much that I'd be upset that I had to have a C-section,
Mm-hmm.
but just that I'd, been there so long working
Sure.
towards a vaginal birth, and then
Yes.
to,
Yeah.
um, you know,
Yeah.
to then have to have a C-section.
Right. Right.
Um,
Right.
so that's where the MD who was on call at that point,
Mm-hmm.
and who delivered me eventually, she was awesome because she said, we can give you another 2 hours. I'm comfortable
Right.
with that. We'll check
Mm-hmm.
you then. You're at 8 centimeters now. If you haven't moved at all in those next 2 hours, like we really should do a C-section.
Okay.
Um, and so then after that, I felt like things really quickly progressed.
Okay.
So like half an hour later, I was asking my nurse, I was like, I really feel, even through this
Something.
epidural, I'm feeling an urge. Like, I need to
Right.
be moving. Like, I
Right.
feel like I need to
Right.
push. I
Right.
don't know necessarily what that's supposed to feel like as a first
Right.
time mom, but I think
Right.
this is what
Something
I'm
is
feeling.
happening. Yes.
Yeah. Um, so they did check me about an hour after that conversation, and
Uh-huh.
I was at like 9.5,
Okay.
completely effaced. She said there was just like a teeny little lip,
Uh-huh.
that was still there. And she's like, we can push through that if you want. There are
Okay.
risks. I think she told me that, yeah, that there would be, a risk of some injury to the cervix if, yeah, by
Yeah.
trying to
If
push
it.
through that.
Mm-hmm. Okay.
Um, but that if I wanted to, that we could. And so I
Mm-hmm.
felt the urge to push, and yeah, I was ready to do that.
Okay. All
Um, yeah. But then I pushed for 2 hours.
right.
So,
Were you feeling better at that point? Like it's
yes.
like a little bit of an
Yeah.
emotional roller coaster. Like
Yeah.
literally just an hour before you were like,
You might have a
some little
C-section.
tear, right?
Yeah.
And then it's like, okay, I'm back in the
Yeah.
game.
Yeah. Yeah. So
Yeah.
then I definitely felt a huge relief, and I've definitely
Mm-hmm.
had people tell me, pushing actually does feel better
Uh
than
huh.
the stages right before that. And I agree with
Right.
that to an extent.
Okay.
Um, yeah. So we were changing positions. I tried being on my hands and knees sometimes. I
Mm-hmm.
tried being on my side.
Mm-hmm.
Um, but he was just stubborn. And I think I was getting tired. So it took 2 hours.
And two
Um,
hours is not bad at all for a first time baby.
that's
Like
true.
for a first time, it really is
Yeah.
not. So I mean, I can say that because I actually haven't pushed a baby since I had two C sections. But in the grand scheme of things, I know it can feel like a long time. But I hope you're not like, oh my god, it took me 2 hours. It
Yeah.
just
It actually didn't feel like that long until,
okay.
the end, where I just felt like I was getting fatigued. And at
Gotcha.
one point she's like, okay, I think you're pushing with your face. You need to take all that energy and, put it down,
Right.
down
Right.
there and
Right.
push from there.
Right.
So that advice helped.
Okay.
But yeah, so eventually, he came out.
Uh huh.
I did have, and we did immediate skin to skin.
Uh-huh. How
We
much did he weigh?
He weighed 7 pounds 1 ounce.
Okay, that's a
Yeah,
perfect size. Yeah.
yeah, it was a very good size.
Hmm.
Um, my husband cut the cord,
Okay.
which was kind of fun because
Yeah.
he's a little bit of a squeamish guy.
Right.
But
Right.
we both wanted him to, and
Yeah.
yeah, he enjoyed doing that. And
Nice.
then I ended up having a third degree perineal tear.
Okay.
Yeah.
So
Um,
what was that like?
that was some recovery.
Maybe was is like.
Yeah, I actually I do feel, 5 months now later pretty much completely healed.
Okay.
Um,
Okay.
yeah.
Okay.
So the way she described it, it was like barely a third degree.
Okay.
So it, barely went into the anal sphincter.
Mm-hmm.
Um,
Mm-hmm.
but definitely required repair.
Mm-hmm.
Um, and so, yeah, for sure, the first few weeks were pretty rough.
Okay.
Um,
Painful.
yeah, painful. I was taking, all sorts of stool softeners.
Right.
I didn't use toilet paper for like 7 weeks.
Because it was just like
Yeah, the
I
Perry
can't do
bottle
it. Yeah.
was
It was like I
was
just
my
can't do
friend.
it.
It
Yeah.
brought that
Yeah.
everywhere. Um, but I think, yeah, I mean, she did a great repair. And then I actually requested to be referred to pelvic floor PT
Aren't you smart? Yes.
immediately. Yeah. So yeah, so that definitely helped. Um, and I'd say overall, yeah, I do feel like it's pretty much back to normal. I haven't had
Okay.
issues with any sort of incontinence. Um,
Awesome.
yeah,
How long do you feel like it took you to get back to where you felt
yeah, I'd
more
say
normal?
probably 8 to 10 weeks.
Okay.
Yeah.
Okay.
So in the grand scheme of things, not that long.
Gotcha.
Um,
Gotcha. And
yeah.
how often did you, I guess, how soon and how often did you see the pelvic physical therapist?
So I saw, let's see, I think I saw her first at like 4 weeks postpartum.
Okay.
I don't think I would have felt comfortable or like just felt
Yeah.
it would not have been comfortable to try to
Yeah.
do it before.
Yeah. Yeah.
And I saw her once a week for about 6 weeks.
Okay.
And then it was honestly just her schedule and my schedule. I could have gone more,
Sure.
um, but just the timing didn't work out.
Okay.
Yeah.
Okay. And you were starting to feel better
Yeah.
about things.
Yeah.
And so, what about the postpartum care from the OB side? I feel like we do such a horrible job. But
Yeah. I
you,
mean, in the hospital was great. I mean, so we were there for
hmm
I guess 3 days, mostly for my blood pressure. Then he had a little bit of elevated bilirubin.
okay.
Never needed any lights or anything else than just time and eating and pooping.
Sure.
So yes, and then I ended up seeing. Um, Again, I guess I requested to be seen at like 2 weeks postpartum because
Okay.
I just had my usual 6 week check, and I was like, I pretty much had a surgical repair of my perineum. Like,
Someone should look at this.
yeah,
Yeah.
exactly.
Yeah.
And they were very accommodating. They didn't fight back on that at all. So,
Right. Right.
yeah. So
But
I
you had to
saw,
ask for it.
I did, yeah.
Yeah. Yeah.
Um, and yeah, and then similarly to the prenatal care, I essentially just saw whoever was available, which is fine again because I
Okay.
had seen
Yeah.
them all in the
Yeah.
hospital.
Yeah. Yeah.
So
I'm
yeah,
surprised they didn't want to see you back sooner for like a blood pressure check or anything.
that they did actually.
Okay.
So I did get seen at 1 week to check my blood pressure, and I was actually
Okay.
discharged on nifedipine
Okay.
because I was still in like 150 over high 90s
Gotcha.
when I discharged. So I
Gotcha.
took nifedipine for 6 weeks.
Okay.
Um,
Okay.
yeah, and then was able to come off it pretty easily.
Gotcha.
Yeah.
Gotcha. Gotcha. And then how was breastfeeding?
Yeah, it was tough. So
Mm. Labor of
um
love, as I
it was
always
so
say.
true. Yeah. And I think for many reasons his latch was not great to begin with.
Mm-hmm.
We ended up seeing, so I saw a lactation consultant pretty much like day of life 5, which was
Okay.
awesome. And she was wonderful.
Nice.
Um So yeah, so we saw her, and then we were referred to essentially a physical therapist for his
Huh.
kind of for oral facial therapy
Okay.
for him, just because he had a he
Okay.
had a kind of a squished little face and a
Okay.
a tight latch, and
Gotcha.
um, so they definitely helped with that. He did end up having a tongue tie clipped
Okay.
at about, I guess he was about 10 weeks old,
Okay.
um, which I think helped. Honestly, I think the thing that helped the most for him was just growing and age and time and
Gotcha.
practice.
Gotcha.
Um, but I essentially ended up exclusive pumping for the first couple weeks,
Okay.
um, which was not how I envisioned it, but I think it actually, in the end, worked out the best, because my husband could help with feeding
Right.
him. It
Right.
established a really good supply for me. I even had like a little bit of an oversupply
Ah.
because of pumping so much in the
Okay.
beginning.
Okay.
Um, but that meant that when his latch, it kind of helped with his latch because of the oversupply and the fast letdown and that kind of thing. It you know I think it helped with his breastfeeding.
Gotcha. Gotcha.
Um, so yeah, so it took some work, and it took a lot of pumping in the beginning. But we're still breastfeeding now, and
Okay, yeah, that's
still
what I was
going
gonna
well.
ask if you're still breastfeeding.
Yeah, we are.
Yeah. Yeah.
Yeah,
Yeah, breastfeeding is obviously you do it, but like it's hard to explain how much your world revolves around it
yeah,
for a long time.
yeah,
For like
yeah,
because you can't like going out to eat, go to the store, when do I pump? When is the next
yeah,
time? You
yeah.
know, so it's a
And
lot.
pumping is no easier. I mean, respect to the moms who exclusively pump, for
Yeah.
months. It's just,
Mhm.
yeah, your whole world revolves around when can I next pump, and
Yeah.
um,
Yes.
yeah, it's
Yes.
really tough.
Do you use the ones that you can just stick in there and
Yeah, so I did.
the hands-free ones?
Yeah,
Okay.
I have a willow or willows.
Uh-huh.
My main pump is a Spectra, which is great.
Okay.
Um, but then I did also get a pair of willows, which TRICARE actually helped pay for, which was awesome.
Oh, nice. Okay.
Yeah, and so I use those um, on like my OR days or like
Okay.
really busy clinic days.
Gotcha. Gotcha.
I've I have the liberty to be able to block out time in clinic, so I don't have to use the wearable ones,
Mm-hmm.
just because I don't feel like they're quite as efficient as um, the plug-in ones. But
Yeah. Yeah.
yeah, but I do
Yeah.
use them.
Okay. Okay. All right. And then how long was your maternity leave? Like how long is a military maternity
Yeah,
leave?
so the military, I think, is actually pretty awesome at their military or their parental leave policies.
Mm-hmm.
So I got 3 months of paid leave. They're
Oh,
actually
nice.
starting, I think, January 1 of 23. It's going to be 4 months. Um, and for fathers, I know it's 6 weeks now, and I think it might also be going to 3 or 4 months for
Okay.
um, yeah, or for the non-birthing parents as
Right.
well.
Right. Right.
Um,
Okay.
yeah, so I took three. I think I might have been able to take four, um, but yeah, it
Okay.
was nice.
All right. Good. Good. So, what is how has the postpartum experience been like overall, and how do you feel about your birth experience?
Yeah, I so the immediate postpartum uh, period was definitely tough.
Mm-hmm.
I had to take my oral boards for orthopedic surgery at essentially 5 weeks postpartum. Uh,
Y'all
and
should see my face right now. Oh my God, that is
yeah,
torture.
it is. And I probably could have asked for some kind of accommodations, but I think the
Right.
answer may have been, "Oh, you can take them next year." But
Yeah,
I'd
it's like
spent a
I'm gonna
year.
suck it up and just do it.
Yeah,
Yeah.
you spend a
Yeah.
year collecting cases, and
Yes.
so yeah.
Yes.
In my mind, the only
Yeah.
option
Do you
was
have to
to do it then.
travel
Yeah,
to?
you do.
Okay.
Yeah, yeah,
Where ours are in Dallas in Texas. Where?
yeah. Ours are in Chicago.
Okay.
So everyone goes to
Okay.
Chicago. So I went by myself still and stayed
Oh,
with my husband, and then his parents were here too.
okay. Okay.
Um, so that in of itself was actually okay.
Uh-huh.
That travel, I felt okay being away from him at that point. I was pumping.
Right.
But the first 5 weeks of my maternity leave were just horrendous in terms of,
Right.
I was trying to study.
Oh.
And then I definitely was not prepared for just the emotions that come with that immediate postpartum period.
Mm-hmm.
Because I'm definitely a very optimistic, glass half full person.
Mm-hmm.
I felt
Mm-hmm.
lucky to never have had to deal with any sort of depression or anxiety, and
Sure.
so just the negative emotions that can come in those first few weeks were
Right.
rough.
Right. I can
Um,
imagine.
and but yeah, I think getting boards done also just with time. The second 6 weeks of my maternity leave were relatively great.
Okay.
um, yeah, and so I definitely um, dealt with the baby blues for
Mm-hmm.
the first couple weeks, but it
Mm-hmm.
did resolve, I'd say, by
Right.
probably by about 4 weeks.
Okay.
Yeah,
Okay. God, I couldn't imagine having to take my oral boards right
yeah,
after I had a baby. Well, I'm glad. Well, I assume you passed and
I
got it
did.
done,
Yeah,
and yes, because then that would be like torturous to have to do it all
to do it
over
again.
again.
Yeah.
Yes, yes, yes. All right. So, as we wrap up, what is your one favorite thing or piece of advice that you would give to expectant moms or expectant families?
I think it would be surrounding that postpartum period,
Mm-hmm.
and just especially for first time moms and
Mm-hmm.
families, giving yourself that grace of allowing yourself to feel emotions in those first few weeks and even months, and let
Mm-hmm.
yourself cry, talk it out with your partner and your family,
Mm-hmm.
um, and then with that, if you have the ability to have help from family or friends in those first few weeks, definitely take it. My mom was here, then my sister came up in the first few days after he was born, and so just to have someone who can cook all your meals for you,
Yes.
walk the dog, do your laundry. It is so helpful. And even if you don't have family that can literally stay, um, taking advantage of friends who want to help,
Mm-hmm.
and even the little things, if they ask what they can do, you know make me a lasagna or
Yeah.
come walk my dog,
Yes.
they'll be happy to do it, and it's one item off your checklist and something you don't have to think about.
Yeah.
So yeah,
Yeah.
so definitely you know taking advantage of that help in the first few weeks, and just being prepared to have those ups and downs of emotions.
For sure. For sure. For sure. All right. Well, where can women find you? Are you on social media or anything?
Yeah, I
Just so they're
am.
aware. Okay.
Yeah,
Go.
I so I'm on Instagram, and my handle is just CC Ski, so CCSKI.
Okay.
And then I'm also on Facebook,
Awesome.
Claudia Thomas. Yeah,
Okay. Do you ski? I presume.
I do. Yeah,
Okay.
um, yeah. And then my maiden name was also Skeeler, so that went into
Oh, that.
the
Well, there
handle.
we go.
But
It fit. Yeah.
yeah,
Yeah. Yeah. All right. Well, thank you so much for coming on to share your story. I know folks are going to find it helpful. I'm already thinking of the things that I want to talk about afterwards in my Dr. Nicole's notes.
awesome. Well, thank you so much for having me. It was an honor.
All right.